Let's talk about paracetamol. I mean, it's in pretty much every medicine cabinet, right? It's our go-to for headaches, fevers, you name it. But here's the thing. What happens when someone takes too much? Well, it kicks off this hidden biological race against the clock, and it all boils down to one absolutely critical number: 8 hours.
And just to give you an idea of how big a deal this is, in the UK, paracetamol isn't just one of the drugs used in overdose. Nope, it is the #1 most common drug. So we're not talking about some rare thing here. This is a frequent, serious medical emergency.
Okay, so that leads us to the big question, right? What is it that makes this such a frantic race against time? When an overdose happens, why does every single second count? What's actually going on inside the body, and why is there this hard deadline for treatment to work?
All right, to really get why that clock is ticking, we have to look at the biological crisis that's unfolding. Think of it like a battle, where the body's own defense systems are getting completely overwhelmed and pushed way past their breaking point.
So here's something you might find surprising. The main problem isn't actually the paracetamol itself. It's what our body turns it into, a toxic byproduct, a metabolite that's created when we process the drug. And this is the stuff that latches onto liver cells and causes them to die. Now, in a normal dose, our body's got it covered, no problem. But an overdose, that's a whole different ballgame.
So, how does our body usually fight back? Well, it has a secret weapon. It's a molecule called glutathione. And the best way to picture it is like a natural sponge that lives in your liver. Its only job is to soak up that nasty toxic stuff, making it harmless before it can cause any real damage.
And right here, this is the heart of the problem. You take a normal dose, it's like a tiny spill on the kitchen floor. Your glutathione sponge comes along, mops it up, easy peasy. But an overdose isn't a spill, it's a flood. The sheer amount of toxin just completely soaks every single sponge until there are none left. The body's entire supply just gets used up, and the liver is left totally defenseless.
Okay, so with that in mind, let's look at the actual timeline of what happens. We'll start with the very first, and maybe the most time-sensitive, chance to intervene.
And here it is. This is the ticking clock we've been talking about. The moment the pills are swallowed, that clock starts. And you can see two really important windows. The first one is super short, less than an hour, for something called activated charcoal. Then you have the main event, the real lifeline, a window of less than 8 hours for the antidote. And after that 8-hour mark, you're in the danger zone.
So let's talk about that first hour. Activated charcoal, it's not really an antidote. It's more of a blocker. It's a drink, a kind of slurry, and its whole purpose is to grab onto the paracetamol while it's still in the gut. It stops it from ever getting into the bloodstream in the first place. But, and this is the key, it's pretty much useless after 60 minutes. It has to get in there while the drug is still physically in the bowel.
But what happens if that 1-hour window slams shut? Well, that brings us to the main show, the 8-hour lifeline. This is about the antidote that can stop catastrophic liver damage in its tracks.
Remember our sponges? Let's bring that analogy back, but think of it now as a rescue mission. So your body's natural glutathione sponges, they're toast. Totally saturated, all used up. The antidote, which is called acetylcysteine, basically works by bringing in reinforcements. It's like a delivery truck, speeding to the liver, carrying a fresh supply of brand new sponges so it can get back to cleaning up the mess. But just like any emergency delivery, it has to get there on time.
And that deadline, it's 8 hours. If the antidote gets in within that window, it is incredibly effective at preventing liver damage. Why? Because the new sponges get there before the unprotected liver cells have been permanently destroyed. Seriously, in this situation, time is absolutely everything.
You know, this urgency is so real that the official clinical guidelines are literally built around it. They say that if a patient shows up after the 8-hour mark, you do not wait for blood test results, you start the antidote immediately. It's a classic case of act first, confirm later, because every single minute you wait from that point on is causing more and more damage.
Okay, so we've gone through the science, we've looked at the timeline. Let's really boil this down to the critical takeaway. What's the most important thing you need to remember from all of this?
It really comes down to this. Once that 8-hour window slams shut, the toxin has had way too long to attack the defenseless liver, and the risk of severe, irreversible, and, yes, life-threatening liver failure just skyrockets. The antidote is still given, for sure, but at that point, it's not a prevention mission anymore. It's a damage control operation.
So to recap, just remember the two critical windows. You've got that tiny 1-hour window for activated charcoal, which tries to block the drug from even getting in. And then you have the big one, the 8-hour lifeline for the antidote to save the liver. But the one rule that trumps everything? It's simple. The sooner you get help, the better the outcome. Period.
So after all of this, the science, the ticking clock, the high stakes, it all boils down to one final simple question. What is the single most important thing anyone can do if they even suspect an overdose might have happened?
It's this: seek help. And do it immediately. Don't wait, don't try to guess. The second an overdose is even